Reports of lung cancer have been down dramatically in the last couple of decades, and every day major progress is being made with new diagnostic tests and treatment. Here at the Orlando Health Cancer Institute, Dr. Ali Jiwani and his team of experts is making a real difference in lung cancer treatment here in Central Florida. Thanks for being here, Dr. Jiwani.
Thanks for having me. Appreciate it.
Okay, first of all, let's talk about risk factors. Smoking is the big one, and a lot less Americans are smoking now than they were even 20 years ago. But what has been on the rise are young people using e-cigarettes and vaping. Have you noticed an increase in young people with lung issues?
We have, and it's a very interesting situation. You know, for many years, people believed that e-cigarettes and vaping was much, much safer than cigarettes, and now we're recognizing that's not the case. And we're seeing people that are as young as 18 with lung cancer, and their only risk factor is that they've been vaping for years.
Okay, so surgery is the preferred method when lung cancer is diagnosed, but it's really only something that can be utilized to its fullest advantage if you catch cancer in the early stages. Why is it so complicated?
Well, it's complicated because traditionally what has happened is that we've always found cancer late. By the time you or I would have symptoms of lung cancer and we get that CT scan, we're already stage 3 or stage 4. So it's too late to be able to do anything other than say, here's chemotherapy and let's hope that helps. In the last 3 years, or last 4 years, we've now seen this explosion of robotic bronchoscopy. And for us, we use a particular robot has really been a game changer for us. It allows us to reach any part of the lung. There's no part of the lung that's inaccessible, and we can get to any lesion as small as a couple of millimeters. So here we actually have a patient's CT scan, and in this patient, they have a nodule that's right there. That nodule is actually only about 6 to 7 millimeters in cross section. So if you think about it, 10 millimeters is about the size of a dime. So we're talking something that's much smaller than a dime.
So this is different, first of all, because you can see it and you can get to it. And the way you get to it is by using AI to help you draw this pathway.
That's right. So our robot uses AI, and it actually takes this CT scan and it processes it and gives us this roadmap. So it gives us the entire airway tree. And you see this blue line. This blue line actually indicates how we're going to reach that nodule in question. We go through their mouth and through the tube, and we can go in their airway and follow the blue line and actually follow it all the way to the nodule. This actually guides me, kind of like GPS in a roadmap, all the way up there.
I don't want to say your job is easy because it isn't, but when you lay it out like this, it seems simple and doable.
It seems very simple and doable. I mean, it is definitely tricky, and you know, once we get there, that's only half the battle. We have to now make sure we actually get the diagnosis, but this makes it so much easier because before, this was half the battle. We couldn't do this.
It's another reason to choose well with Orlando Health. If you would like more information, you can visit orlandohealth.com/cancer.